epidemic in the Asia Pacific is really different from other areas of the world, in particular sub-Saharan Africa, where most of the HIV infections are located. And that's because in the Asia Pacific, there are a couple different drivers of the epidemic, the populations of individuals who are at greatest risk. So in the Asia Pacific, that includes MSM, or men who have sex with men, as well as injection drug users. And so for that reason, the solutions that we have to address the HIV epidemic in the Asia Pacific have to be different from the solutions that are used in sub-Saharan Africa. Thailand has long been a model of HIV programs, whether it's research, community outreach, drug development, and drug licensing. Thailand has really set the pace for the rest of the region. So at the same time that Thailand has been a model, it doesn't mean that everything is as we want it to be. There are still many problems with stigma and discrimination against people who live with the disease and people who are considered at highest risk of the disease. So Treat Asia is a program of AMFAR, the Foundation for AIDS Research, which is a US-based foundation focused on HIV research. But Treat Asia was a different approach to the epidemic than what we have done in the United States and other Western countries. It was felt that the response to HIV could not just be about treatment or education or research. It had to be a combination of these things. So Treat Asia is a program that addresses issues related to research, but is also focused on community development, outreach, antiretroviral treatment literacy, as well as education, not just for patients, but also for clinicians, the healthcare providers who take care of the people with the infection. I think one of the biggest challenges that we have in the region is to be able to reach those people that are known as hidden MSM. These are MSM who may be at risk for HIV or who already have HIV but do not know it. And they are too concerned about stigma and discrimination, whether it is by their community, their family, or the healthcare provider. They're too concerned and possibly even scared to come and access prevention and care and treatment services. Trying to reach this group of MSM is critical to the success of HIV prevention and treatment programs within the region. One of the more innovative ideas that we have seen recently to reach hidden MSM involves the use of the internet and social media, such as Facebook, Twitter, or other forms of communication, to contact people in really the privacy of their own home or their own computer. This is a way to reach out to people who would otherwise not seek out information or care from so-called professionals who might be in a government clinic or even a private clinic. This is a way to access free information in a way that is non-threatening, that people do not have to reveal their identity and can feel safe. By supporting this type of an effort, I believe that we can begin reaching hidden MSM in a more proactive way than we have in the past. There have been some research studies, primarily in Western countries, that have said that the internet is being used to increase risk behavior among some communities of MSM. At the same time, the internet can also be used to promote prevention messaging. And I don't think that we have utilized social media or communication strategies that address young MSM in a way that's been very effective. So to use technology to our advantage is something I think we have to do to be successful. I think the Anonymous Clinic plays a critical role for the people of Bangkok. But I think what many people here do not realize is that the Anonymous Clinic is actually a resource for people outside of Thailand and in the region itself. There are a number of people who, if they don't travel here themselves to get health care, they send their friends to come here to try to learn about the newer treatments and find access to antiretroviral drugs. The Anonymous Clinic is not just a model, but it's a safe place that people can come to receive high-quality care and drugs that are also of a high quality. So people don't have to worry about counterfeit medications when they come here. The doctors here are also very flexible and understanding of the challenges that people are facing, not just here in Thailand, but in other countries in Asia. And that kind of desire, this willingness to be flexible, to see the community as the center for prevention and treatment efforts is pretty special and really should be viewed as a model for others. When I learned about the Adam's Love website, I think what really struck me was that this was a completely non-commercial website, because the Thai Red Cross is supporting both its development as well as its operation. And it's not just about financially supporting the website itself, it's about committing human resources and expertise so that the website is reliable and relevant to the needs of people who are at risk for HIV and have HIV. It's a very unique approach, a combination of education and entertainment in a way that I think people will access. People won't look at it suspiciously as a tool of the institution or of the government. It will be viewed as something that is for them as well.